All right, next speaker, Matt Salo, Director of the Health and Human Services Committee, National Governors Association. The NGA is the bipartisan, I made sure to say bipartisan, you're welcome, organization of the nation's governors, promotes visionary state leadership, shares best practices, and speaks with a unified voice on national policy. Matt Salo.
Bipartisan perspective, from a state perspective, from a beneficiary perspective, extending the enhanced Medicaid money in the FMAP for another 6 months is absolutely critical in terms of helping keep state budgets afloat throughout the rest of their current fiscal year. And to sort of to reinforce a little bit what Michael was saying in terms of the big picture here, I mean, what we've really seen in terms of the state budgets has been shocking in terms of, you know, we haven't just been dealing with slower rates of growth, which, you know, slower rates of growth can be a problem because the population continues to grow, the cost of goods and services continues to grow, especially in healthcare. But the problem is, we're not just not keeping up with the increased cost of inflation, the increased cost of providing healthcare and other services to more people. Expenditures at the state level have actually been negative for 2 years straight now, which is unprecedented in modern American history. And as bad as 2011 is, our indications are that 2012 is actually going to be worse. And that what we are looking at is, after all of the hundreds of billions of dollars in cuts and tax increases that Michael talked about, we're looking at another $120 billion between now and the end of fiscal 2012 that we need to cut or tax our way out of. And as Michael said, we've done all the easy things. And so what's left are really difficult things. And why does that matter, you might ask? And it matters because there is a fundamental link between state economies and the national economy. The taxpayers of Maryland are federal taxpayers. The taxpayers of Alabama are federal taxpayers. And when states, because they are forced to balance their budgets every single year, when states are forced to do things like massive tax increases or massive spending cuts, that is anti-stimulative. That drags down the national economy. That prohibits the national economy from fully revving back up. So it's important. It's not just because, oh, isn't it quaint, the states have their little budget problem, you know, maybe we could help them, maybe not. They're linked. And when states don't have the resources to balance their budgets, they're cutting education, which means lost jobs for teachers. It means lost future productivity for our children. When states don't have the resources, they're cutting police officers. We all know where that leads. So what I'm saying is there is a very real connection here between what the states are feeling and what's going to happen at the national level. And what we don't want is for the difficult decisions that states have to make to drag down the national economy and prevent the national economy from being the true engine of progress that it can be. So it's in that context, really, that, you know, an additional $25 billion really is going to make an enormous amount of difference. You know, a number of states have built it into their budgets, a number of states haven't. You know, the sad truth is that, you know, whether it happens or not, there are still going to have to be changes. You know, there are going to have to be revenue adjustments at the state level. There are going to have to be cuts made. But I think we can all agree that, you know, wouldn't it be nicer that we had $25 billion less in job loss, $25 billion less in potential economic drag of tax increases? And in terms of taxes and spending, you know, again, those are really the only two ways a state can get out of a budget hole: tax more, spend less. And traditionally, it's always been a balance of the two. Last year, as part of the balance of getting to a balanced budget, states increased taxes about $30 billion. This year, they're only going to increase taxes about $3 billion. And by and large, that's because we're going into election cycles. And it's always very, very hard to increase taxes at the state level. Why does that matter? That means that all of that money that's going to have to make up the $120 billion shortfall is going to come out of spending cuts. And as Michael said, where do you go when you need to find spending cuts at the state level? All the money's in healthcare or education. And are those the right areas that we want to be jeopardizing America's future in? Ideally, no. With respect to Medicaid, as Michael said, the $87 billion that's already flowed to states through ARA has been incredibly helpful in helping keep Medicaid solvent over those years. I think our very real concern is that if this money stops at the end of December of this year, states are going to have to look to Medicaid. Medicaid's now 22% of the average state budget. They asked Willie Sutton, why do you rob banks? And he said, well, that's where the money is. Why do you cut Medicaid? That's where the money is. $25 billion in additional help helps prevent some of that. And honestly, one of the challenges that we're going to face is where are states going to go to cut Medicaid if they have to, and many have to. You can't cut eligibility. You're probably not going to cut a whole lot of services. The easiest, and I say easy with little air quotes, but the easiest way to go is going at reimbursement rates for providers, doctors, hospitals, nursing homes, etc. And as has been mentioned before, Medicaid already doesn't pay very well. We pay about, on average, 70% of what Medicare pays, the same service, and Medicare pays about 70% of what the commercial market pays. So we're already at a pretty low overall rate. Doctors aren't real happy with Medicaid. But I can guarantee you that without $25 billion, a lot of that's going to come out of further cuts in reimbursement rates to doctors, to hospitals, to nursing homes, etc. And so you won't see states cutting eligibility, but you will see reimbursement rates go so low that you can have a Medicaid eligibility card, but it's a hunting license. Because good luck finding a doctor who's going to take 30 cents on the dollar to see you. That's not helpful in the grand scheme of things. But I fear that's where we're going to end up unless something is done. So I'm just going to put all of that in the big picture and then sort of close off with, a lot of people have said, part of the reason why it was dropped out of the House bill at the last minute, I think, is in part due to concerns about the size of the package, the overall tax extenders package, the concerns about deficit spending, to which I say, I feel that. I hear you on that. Perpetual deficit spending is not a good thing. But I think this is different, because this is not purposeful, permanent deficit spending. This is an instance in which the federal government can actually act like the adult in the relationship with states. Because the states have to balance their budgets. The federal government can actually take a longer range view and say, we can do a little bit of deficit spending now to ensure the permanent, long-term sustainability and growth of the engines of the economy, which are in many ways the states. So I will say it may be deficit spending. The FMAP is not offset. I think it is appropriate to do so, and I think it is in fact vital to do so. So I'll end there, and I'm sure there are lots of questions, and I'd be happy to take